Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright, Solia, tell me what's going on with your shoulder, what happened?
Well, I have a pain that irradiates like from here down here and goes back, and I believe it might be work related because it gets worse when I work several days in a row, and it's becoming pretty constant recently. So
what, can you show me the posture of work?
Yeah, well, we have double screens, a keyboard, and the keyboard can be lifted up or down. We have a stand-up desk, so I can regulate that. But yeah,
what do you do?
I'm a pharmacist. I work 10-hour shifts in front of the computer.
Okay, so a lot of repetitive motion that might aggravate.
And we have a roll mouse. That doesn't really help me. At the beginning it did, but now it doesn't.
So how long has it been going on?
A few months, I would say 3 months.
Okay, 3 months. So what kind of treatment you had for this?
Actually, just try to rest, try to change the height of my keyboard, so the lowest it goes, the less pain I have. But other than that, I took some ibuprofen, but I know that's not a permanent solution.
Temporary.
Yeah.
So how much pain from 0 to 10 at worst, and what motion aggravated?
Like the last day I worked was 2-3 days ago. It was, I would say, 8. It was really...
And it's from the back and radiated to...
Yeah, it would feel worse here, but it goes all the way here.
Okay. So what about now? How much pain?
Right now, I say 4 or 6 because I didn't work the last few days. So, yeah.
Okay. So let's do several range of motion and let me know from 0 to 10 how much pain with that. Okay, so thumb up and bring your arm up all the way to your head. How much pain with that?
2.
Okay, thumb up here and bring it. How's that?
It's not painful.
Okay, I want you to do this.
Yeah, now I feel more.
0 to 10?
4.
4, so we're gonna use that for testing. I want you to do this.
3 or 4.
3 or 4. Can you do any other motion that aggravated? Do you feel something catching there?
Yeah, maybe this will hurt. I wish I had been here, like the last day I worked was worse.
It's worse. And you said with weight you feel it.
Yeah.
How much weight?
And then after I did this move, not the pain might not be there when I'm doing the move, but when I rest, it just...
It's afterwards.
Yeah.
Okay, so...
Like now I feel the pain.
How much?
It's going up, like I would say 6 or 7.
Okay, can you do this? And...
I feel like my range of motion is not normal there.
Relax. So resting like this, it's not painful, isn't it?
No.
You feel that tightness, but you don't have like, you cannot recall like fall or injury that happened. It's just repetitive strain injury. Okay. Relax. Relax. I'm gonna give you over here. Rest your arm on it. You can rest both of them.
That hurts, but it's just the pressure doing, right?
Make sure it's not painful. If you feel pressure, that's fine. But pain, it's not fine.
That's hurting.
Sorry. How's that? Is that painful?
I feel like it's going down a little bit.
Like
a little bit, yeah.
Okay. No pacemaker or seizures or anything like that. Okay. about here?
No.
Any sharp pain by then?
No sharp pain. Just the pressure. Oh yeah, there.
Oh, okay. Yeah, get a knot here for this one. What about when I do it this way?
Yeah, it hurts.
It hurts. So it's a little bit inflamed in that area. That's why you're not tolerating. This is the pressure I'm applying. Is it hurting here?
Yeah, I think it's just the pressure.
Is it hurting?
Oh yes.
What's going on here? Okay, let me see the other arm. You're right or left-handed? Is this hurting here?
Yeah. Well, it's about the same.
Was it hurting? With this light pressure, it's hurting?
Well,
Or just sensitive to touch?
maybe I'm sensitive. This hurts here. It hurts.
The whole thing, this is not a good example. But this is a light touch. Is it hurting here?
Yes.
Okay. You have inflammation. Okay. So I'm gonna desensitize that. I have a tool called MagnaHeal. Use magnetic field to decrease localized inflammation. So I'm gonna try to use that and see if I can get your inflammation down so you can tolerate more
Okay.
work. Is that painful here? It's okay.
No.
How does it feel?
No.
And your pain superficial, not deep, yeah?
I don't know.
Do you have any neck issue?
No.
Okay, let's see now. How about now? Is that painful? It's okay.
It's okay. That's hurting.
That's hurting. Just touching like this is hurting.
Oh, that hurts.
No. So your pain starts from here or here? I'm radiating.
It goes to the back here.
Yeah.
Today is not bad, but like when I've been working, it hurts more.
Got it. Thank you.
You're welcome. Okay. What about now?
Yeah, it's painful.
It's painful. I want to show you how strong this magnet. Try to push my hand, just to very lightly push it. You feel the resistance? You feel that's resistant? That's a magnetic. That goes deep. Like we measured it, it was like when I add them, it's a range 4 to 5 inches. Is it too much? What I'm doing is okay.
No, I don't have pain. So that magnetic field decreases inflammation.
Yeah, so when they measure the voltage in the cells, they found the inflamed area or the injured. The normal cells voltage should run between 20 to 25 millivoltage. The inflamed cells or injured area the voltage went down to 5 to 10 millivoltage.
Oh.
So think about this way. Well, cells need electromagnetic currents to actually communicate. So if your voltage is low, that electricity or magnetic currents is actually decreased significantly. So the goal is actually the magnet is increase the voltage in the cell, so you start to have more conductivities. You know, so that's actually the goal of the magnetic. And I have anti-inflammatory coating on this magnet. So that's what I currently. You did not see that. This is just a very recent tool.
No, no, you didn't use that. You have this electric little discharge, like a.
Yeah, that's a pulse electromagnetic machine. It's a different. This is just magnet. Yeah. Okay. And you complain of here too. Relax, relax. Okay. You feel that knot?
Yeah.
And you do a lot of typing, so that's probably why your hand is like, you have a lot of scar tissue here. You feel that? And here, feel that? When did I see you last time? Like for different issue?
Yeah. Maybe like 6 months ago.
6 months ago. What you came for?
For a pain here on the face. It was shooting really badly. I couldn't even drink or eat. I couldn't open my mouth.
Yeah.
It was really painful.
How many treatments you had for that?
3 or 4.
Yeah. Nice. And how long you had that
The problem, that happened abruptly. I ate something and the pain shoot really fast.
How long that's been going on?
That was maybe a month, but it was really bad. It was terrible.
So you had 3-4 treatments. That was 6 months ago. Did you have any symptoms since we finished the program?
No, that was
That's
gone.
nice.
Yeah, it was great. I was surprised. So I did all what you told me, like the vitamin C, the turmeric, low sugars, no caffeine, all these things. And I'm on a low carb diet anyway. So.
Yeah, that's good. That's good. Yeah, that's part of ASTR program. Put patient on an anti-inflammatory diet. If there's like vitamins or mineral deficiency, we have to address that. We do a lot of testing for that.
I recently had a lot of testing, so I can show you the.
Yeah. Can you bring it next time? All
I
the
had
blood work.
I had today all the blood work and the.
Yeah. So we'll have probably more time next time to work to take a look at that. So that is part of the nutrition analysis. Okay. Any pain, discomfort here?
Just some soreness. And also on Friday after work, because I was in so much pain, I went to a massage therapist by my house, and she went really deep, so some soreness is still there.
I will not do deep tissue massage because what I feel, there is a lot of inflammation here. So, think about if you have open wound, do you rub that? Internally, when you have inflammation, that's like an internal wound, but the skin covered. You don't want to rub that because it's going to inflame more. Does that make sense? So I'm not really crazy about deep tissue massage to begin with. There's like some study shows it's not actually, period massage does not provide long term. There's like at least 6 to 7 systematic reviews saying that. But deep tissue massage could cause harm actually. So I will be gentle with that. Okay, let's drink some water. And then want you to move your arm and tell me how that feels.
I feel like I'm still limited there.
Where do you feel it? Which area? In that area?
Mm-hmm.
You feel something catching there?
Yeah.
Okay, relax. And the catching in the shoulder joint or the scapula?
I think it's a scapula.
The scapula is the one that's catching in here, yeah.
Mm-hmm.
Mm-hmm. Okay, let's drink a little bit more water and try to. How's it feel?
I think it's better.
Is it gone or still feel it? Let's do the other motion too, flexion, abduction, everything.
Like this?
And do the side like this. How's that?
I think it's better.
Any catching?
No.
Any pain, discomfort?
No.
Okay, you can turn around and... Okay, we'll move again. Do the motion that was aggravated before. Doing this and other motions and tell me how that feels. Any pain, discomfort?
You know it's better.
You've been doing more than when we started. It was just painful doing
Really?
one time,
Yeah,
a couple of
I
times.
remember.
Yeah, you did like at least now so far probably around 10.
Yeah, it's better, doctor.
Any pain or it's gone?
I don't feel the pain I was shooting.
Alright, so what do you think about ASTR treatment? Just a few minutes working on it.
I already knew it's wonderful because I've had a really good past experience. So I'm not surprised it's helping. I knew I had to get this done, so thank you.
Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!